Hey, Dr. Stoker.
Hi, Quinn.
Let's talk about a facelift, a total facial rejuvenation.
That is a great topic.
Yeah, what does it include?
Okay, well, facial rejuvenation is a broad topic because we all look different with different ages, ethnicities, and so on. But in general, a face and neck lift is lifting the neck and lifting the lower face. That's kind of a fundamental procedure. But before we even get to the big surgical procedures, we do a lot of fillers and Botox, such as you do in your practice, right? But you can only take somebody so far with that. And you want to delay surgery by doing a lot of Botox to prevent wrinkles from, or just slow the wrinkles from happening. But if you overfill somebody, which of course you're not going to do, but they start to look masculine and artificial and recognizable as having done too much filler.
Yeah.
So that's when surgery becomes relevant. There's still a role for fillers and Botox, but then it takes kind of a back seat to the surgical procedures.
I do agree that some patients come in and they want facial fillers, and facial fillers can only do so much. Like, I have to be honest with the candidate if they are a candidate for facial fillers or if they're more surgical. And I think a facelift comes into play sometimes for patients that don't necessarily or can't achieve the desired look with just facial fillers.
One other thing I'd mention is that it's always a challenge because patients can get somewhat used to fillers, and used to an unnatural appearance and want more and more. And a job that you have especially, and I have to a lesser degree, is saying no to the patients when they want to overdo the fillers, and because you don't want them to look artificial even if they don't realize it, because it's not in their best interest ultimately, and certainly not in our best interest to do something like that for patients. But that transition to surgery is really important, and because we work together in our office, it's a natural flow. But in an office where you didn't do both surgery and fillers, you might be tempted to just keep filling.
Yeah, I agree. I think there's a place for each, and each one has their perfect place for a patient. I feel like whenever I'm in the room with you and you're speaking about face lifts, you always speak about the neck, and it's always with the lower face. Why is that?
Well, this is where we show signs of aging pretty early on. The skin is thin, it gets a lot of sun exposure, people are less diligent about protecting it than their face, and there's a lot of action going down on the neck. That's also powerfully treated by the deep plane and traceless techniques that I use. The jowls are another area that is part of the facelift that is really well treated in the nasolabial folds. Some people think a facelift is lifting the brow, but that's not it at all. We call that a brow lift. One thing I want to add, though, when we talk about facial rejuvenation, we mentioned non-surgical and then the face and neck lift, but there are many other ancillary procedures that I do the vast majority of the time. Upper and lower eyelids are widely known as something, and that's probably the first surgical procedure for most, because we're looking each other in the eye right now, and that's what we do to determine our age. Do you call me doctor or sir? Am I older or younger than you? And are you happy or sad? It's in the eyes, and the skin is thin and very reactive, so that's an important place to start. Chin augmentation is something we think a lot about too. If you've got a weak chin, it's really hard to get a great jawline and neck. Fillers can take you a certain length, but chin augmentation with an implant can be very helpful. For rounder, chubbier faces, buccal fat pad can be very useful. And a powerful tool that I love on any patient with kind of lighter or even medium skin is fractional carbon dioxide laser resurfacing. I know you do that too in your practice at different settings, right?
I do, yes. Much lighter settings than what you would do under general.
And just for the audience, fractional laser resurfacing makes you raw afterwards. So you look ugly for a few days to a week. In the office, you can do it on lower settings with less downtime, less results. But as we crank up the power for big time results, it hurts and there's more recovery time. So when they're under anesthesia with my procedures, it's a natural fit because they don't feel anything.
That's
and they've got recovery anyways. And it's kind of like remodeling your kitchen, right? If you don't change the cabinets, you're going to notice it. It's going to stand out later. Likewise, when you're doing each of these ancillary procedures and finishing off with a little bit of Botox and fillers, I think you can get a very harmonious result. And again, that's my opinion, but our audience should check out the photo gallery in the traceless facelift category and their entire face category and see what it looks like when it all comes together. We can make some people look 20 or more years younger and not look like they've had plastic surgery. That's cool.
That's magic. I feel like everyone's so happy once they get their facelift, their CO2, and any other kind of addition that you see suitable. I feel like they are so beyond happy post-treatment. Just seeing them come in, they look amazing.
It's pretty life-changing.
Yeah.
But I would also comment, it's not all fun and games for the patient. You know, that first 3 to 5 days, we spend a lot of time anticipating that and supporting it and saying, stay positive, don't stare in the mirror, don't obsess over it today. You got to get through this awkward, ugly stage here. And then the rewards start to happen.
You're almost like a face coach. You have to kind of give them some prep and some confidence for those first couple of weeks.
The prep is a veteran maneuver. I've been there, done that many times. So I want them going to sleep happy and confident, and then they wake up that way. You know, one thing that I find universally true and really funny, comical, is how quickly patients forget what they looked like last week. They can look 20 years older for 20 years, and then they do the surgery, and the next day they forget all about that.
I would too. I'd be like, toodles, I don't remember what I look like.
Maybe it's a natural protective mechanism, or, you know, truthfully, I kind of still imagine myself having just graduated college, but realistically that's not the case. But it is amazing when I pull up those before pictures, and at maybe 10 days and 1 month, compare them right there with the patient. I love that moment when their jaws drop and they get goosebumps. We all have goosebumps. We're like, I can't believe it worked so well once again. And it does, time and time again. It brings tears to my eyes, actually, just thinking about it in general and all those lives that have been really positively changed. It isn't just a trivial thing.
Yeah, it's so rewarding, I feel like, to be in this profession, to see the full rejuvenation of someone.
It is. People value it, that's for sure.